grab gloves for these guys.
Hello, my name is Andre Tollers from Richmond, Virginia, and my question is, are you part of an orthopedic fellowship?
Yeah, so that's my DA told me that I have a ring, a special ring for that. Yeah, so I'm part of the American Academy of Orthopedic Surgeons, so I'm board certified in orthopedic surgery. That means that I did all my training, did all my tests, and got passing grades and all those things in American Academy of Orthopedic Surgeons. I'm also a member of the American Association of Hip and Knee Surgeons, which is a subset of people that do high volume of this. Okay, and then there are different organizations that you can be part of, local and like Ohio Orthopedic Society, Columbus Orthopedic Society. You can be different. There are different subsets within the specialty that you're in. American Foot and Ankle Association, hand surgeries. So, but I'm a member of the American Association of Hip and Knee Surgeons, and should get that right there. Actually, how about a pituitary? And then, and so, yes, I am.
You have a question?
I'm just cleaning right now.
Hi, I'm Hannah Duran from California. How many procedures did it take for you to become fully confident with making an incision?
Today was the day. I was feeling good. So Jen, my PA, she gave me this book, vis-a-vis a friend of hers, that was called Outliers, and it says you have to do 10,000 things to be proficient in something, or to be really good at it. So I'm past 10,000, so I'm pretty good at it, I think, because of that. So it is like anything. Practice makes perfect. That's how you get good at anything. And the exact number that you get to know that you feel comfortable, I don't know what the number was, but I felt comfortable making incision when I was done with my training, for sure. So it's a lot. I mean, we did a lot in our training, thousands. And since I've been in practice 12 years, and I've done in practice thousands of these. So, and again, I would tell you that's true of everything. So anything you do, whether you're gonna give a talk at school, the more you practice it, the better you're gonna deliver it. The more you practice your math facts, the better you're gonna be at them. I mean, this is true of everything in life. The more you do, the better you get. Okay, so remember we said the cement will heat up over the next couple minutes. So we have a piece of cement that's in this bucket of warm saline there, and Jen is kind of bathing the implants in the knee with this warm saline. And this is attempting to warm it up a little bit further, set the temperature. While we're doing this, we're going to walk around the room. We have about a couple minutes here of cement setup time. You can see it's still doughy, right? So it's got that Play-Doh-like consistency at this point. And again, it's going to set up warm over the next 3-4 minutes. So while we do that, we got 3 or 4 minutes of just downtime. We usually wash out the knee or do something. Sometimes when we're waiting, we like to tell a little joke. Would you like to share yours, or shall I share mine?
You can share yours. Yours is better.
All right, Heather had a joke. My 5th grader, these are all PG jokes. Sometimes they aren't, but these are PG. So my 5th grader shared one with me last night that I will tell you. Heather, why was the mushroom repetitively invited to all the parties?
You want me to say the answer?
No, you can ask me why.
Why?
Because he was a fun guy. Nice. Okay, along those lines, we will move along from the jokes and walk in the room. We'll talk to everybody in the room and see what their careers are and how they got there and what they're doing.
My name's Jen. My undergrad background was in athletic training from Indiana University. My graduate degree was in physician assistant sciences. PAs can work in any setting. They work under the supervision of a physician. My role today is to help assist with retraction. I'll help with closure at the end. See the patient in the hospital as well as the office. PAs can work, like I said, under supervision of a physician, but can prescribe their own medicine, see their own patients.
Kara?
My name's Kara. I graduated from Columbus State. My job today is basically to prepare the instrumentation for, excuse me, Heather's shoving the microphone in my face. Prepare the instrumentation for Dr. Politi, try to stay one step ahead. My job is also interchangeable with what Beth did here today. So.
You still good?
I'm Dr. Ruska, the anesthesiologist, and kind of like Dr. Politi, it's 4 years of college, 4 years of medical school, and for me it was 5 years of training afterwards. In anesthesia, I also did a year of fellowship in pain management, and actually started out in general surgery and wasn't enamored with it, and I switched to anesthesia, training Cleveland, the Cleveland Clinic. Thanks. I'm not sure if you can you see the audience here. The top line there, the green squiggly lines, that's the EKG tracing, that's the heart tracing, shows electrical activity of the heart. The line below that also, that's showing a 0, it's not bad, it's actually good in her case, but she does not have a breathing tube in, so she's breathing on her own. The line below that is oxygen saturation level. She has a little bit of sedation, she's actually kind of sleeping comfortably right now. So her oxygen saturation level is 97%, 100 is obviously the max. And the numbers below that, the 96 over 44 is her current blood pressure. So even though she's having surgery and she's got a tourniquet on her leg with a spinal anesthetic, she's totally insensate and she's resting comfortably.
Thank you, Roger. That's right. Okay.
I'm Mike. I'm the Johnson & Johnson sales representative helping out today in the OR. My role is to make sure that Dr. Politi and his staff have all the instruments and implants necessary to complete the surgery.
Okay, and I'm Heather. I am the circulating nurse in the room today. I have a 4-year bachelor's degree in nursing from Lone College in Canton, Ohio. I have been a nurse for about 5 years now. I worked on an orthopedic floor for a little over 2 years, and I've now been in surgery for the past 2.5 years. I do mostly ortho and a little bit of neurosurgery. As Dr. Politi said, we help get the patient ready in the preoperative area to bring back to surgery. We help the anesthesiologist put the patient to sleep in this case. She had a spinal, so just helped get her situated to get that in. And we open the sterile supplies. I do all the charting, and it's fun working as a team. So
excellent. So relax. I think we don't hardly need it. I already told you my training. I went through a less traditional. I went through a 6-year med school instead of 4 and 4 right out of high school into a 6-year program. And then following that, I did 7 years of training, and then been in practice now for 12 years. And so this whole process is a team, right? So there's a patient pre-op in the OR. You can see there's a lot of different elements. There's people doing things that you don't see. There's a lot of careers in medicine that are available to different people with different aptitudes and skill sets and desires. So, and lots of pathways that you can get into here. So hopefully that's helped open some eyes for you throughout this. We're doing our closure now. Closure we do in layers, like we went in layers, right? So this is a dissolvable stitch, which is barbed in one direction each way, and the barbs catch. So it's kind of like a fish hook that goes and bites in one direction and can't go back. So it's knotless, which is very cool, and it's dissolvable. So every throw we make, it locks on itself, and it makes for a bunch of little segments that are all individually stable, and then the cumulative portion of this suture is ultimately stable. So we'll close this in 3 different layers, which you'll get to see us do, and it's a running stitch at each layer. And as we do that, you guys can fire away questions.
Kate, do you have a question? Hi, I'm James Zach from Prince Frederick, Maryland. How many of these knee replacement surgeries do you do a year compared to other surgeries?
So I just do hip and knee replacements, that's it. I do lots of redos, so like complicated redos, disasters, problems that get sent in. And then I do lots of first-time surgeries, somewhere in the neighborhood of about 600 or so a year. So this is a atypical day because we're broadcasting to you guys, so we're just doing a couple. But normally, like yesterday, we did 9 surgeries, and that's mostly what I do.
Austin, do you have a question?
Hi, I'm Dan from Minneapolis, Minnesota. And I was wondering what would be the possible consequences if you were to undersize or oversize the prosthetics that you were putting into the knee?
Okay, so if we overstuff the knee, then it's too tight. So it's kind of like, you know, if it's too tight, then we're going to try and close everything over it, and it would be like putting you in a suit jacket that was too small. And you try and close it, and then you rip it, or it would be too tight, or you'd be constricted in your motion. So if the implants are too big, it makes the soft tissue envelope around it too small, and relatively speaking, and therefore too tight. And that's what she feels. She's not going to feel whether these implants are too big or small. What she'll feel is their relationship to her tissue. If they're too small, then you're not using all of the bone to support the implants. So the consequence of too small is that you've either resected too much bone, or that that they're not being supported by as much. So if you could have a building, a skyscraper supported by a larger base, has less chance of falling into the ground, and as opposed to putting it all on a pin, right? So, so just more support.
Do you have a question?
Hello, my name is Jacqueline, and I'm from Sugar Land, Texas. And my question is, what advice or tips would you give to those who are interested in surgery?
Okay, so if you're interested in surgery, then you know, there's lots of ways you can get involved in this. First thing you have to do is, you know, do well in school, because you have to, you know, take care of business, right? You have to get good grades, you have to work hard, study, and there's lots of pathways you can get to this that are alternative. If your grades aren't perfect early on, you can work your way up. But that's first off, is make sure that you always keep your doors open. And that would be a message for everybody on anything. So you always try at everything, because you never know really what direction you're going to go in your life. So you kind of put your best effort forward. That's what I tell my kids all the time, and sometimes they listen. Then as far as exposure to things like this, well, this is a good exposure, right? And then you go home and you can volunteer in different capacities around your community that gets you into the OR, maybe. Also, there are entry-level jobs for people that are trying to you know, pay their way through college. So we have essentially what you would call orderlies, or medical assistants that help position and drape and clean the rooms, and they're in the OR. And we had a nice kid who was doing that for a while here, who's now an anesthesiology resident. You did that too, Kara? I didn't know that. Yeah, so there's a lot of people who started that entry-level position as they're working their way through. And then